Dr. Trey, round of applause. Yeah. Dr. Trey, do we have a question today from somebody from the listening audience?
We have Ethan from Texas. Is shoulder impingement a real diagnosis? I've been told it's still taught in PT schools, but I've seen research that has debunked it.
Ooh, I like this. Dave is back. Bam! That's right. Dave Tilley, everyone. So Ethan from Texas wants to know: is shoulder impingement still a real thing? Because he's seen research that debunked it. So I guess the question is: did you really see research that debunked it, or did you see a social media post that's debunking it? Let's talk about this a little bit. So what do you guys think? So let's start with this: is shoulder impingement real? That's kind of like, I don't even think that's the right question to ask, but who wants to start with maybe why we're even in this situation where we're debunking shoulder impingement?
I'd like to talk about shoulder impingement.
Yep, I would like to listen to you talk about shoulder impingement, Dan.
Well, I think here's what's tricky, right? So there's different types of impingement, right? So you have impingement of the supraspinatus, you get impingement of the infraspinatus and layback with pitching, so there's different types of impingement. You impinge different structures, right? So it could be different things that are going to be painful. So when you think, oh, shoulder impingement, that's a garbage pail term, doesn't mean anything. I think the other thing is that when we're finding that when people have tendinopathy and when people have cuff tears, it's not just due to compressive forces, it's also due to tensile forces. And there's cases where people are not getting compressive forces, but they're getting cuff tears anyway. So I think this thought, and that this is what's kind of going around social media too, is that compressive forces doesn't make sense. Impingement is not a real thing. And I think the other piece is that due to kind of our knowledge of nociceptive feedback coming from physical therapists, we're afraid to give people this idea that if I bring my arm overhead, we're going to impinge structures. So we use something like a rotator cuff tendinopathy instead. And for a lot of our younger athletes, I often feel that rotator cuff tendinopathy is not even an accurate diagnosis because they might not even have that pathology quite yet. So I think we're struggling for a term. At the end of the day, I think it still exists. Impingement is a real thing that's occurring, so it's not fair to say it doesn't exist, but it's probably a multi-factor thing going on within the shoulder causing problems.
I think the real issue here, like listening to you and I think that's the real issue, is that anytime anybody has any type of shoulder pain that isn't surgical, it's impingement. And it's, what'd you call it, garbage pail?
Garbage pail term.
Garbage pail term. Do we say pail with that or just garbage term?
I don't know. I stuck the pail in there.
I like the pail in there. So, it's a junk term. Right, so it's a junkyard term. Like shoulder impingement means nothing, and I think the problem is everybody in the world that has shoulder pain, we say it's shoulder impingement. And yeah, impingement is a biomechanical term that something is impinging, right? So it's very, very vague, very, very broad. And if you say everybody has shoulder impingement, then yes, we're not going to have one special test to diagnose it, and we're not going to have one treatment that's effective to do it. It's way too broad, it's way too vague, and I think that's a big part of it. So I think Dan brought up a lot of good points in there, like tendinopathy, cuff tears. I think we're questioning whether or not they come just from compressive forces, which you would argue impingement is. But I do think there's also a component of, do you increase inflammation and then you have decreased tensile stress to shear as well, and then maybe something has a compressive impingement but then has a lower ability to handle shear. Right, so I've always kind of considered that all like in one kind of realm. Even if you start having some of these like kind of tensile tears of the rotator cuff or even undersurface tears, does it all happen because of this cascade that may be happening? So we don't know any of these answers, but I think one of the first issues that we have with shoulder impingement is that it means nothing. Not everybody with shoulder pain has we can't call that shoulder impingement because there's so many different reasons. So who wants to go from here? I get tons more, but
my only 2 cents, I think, adding on to you guys, is it's so hard to differentiate the structures that are like truly preferring pain, right? Like especially in the anterior shoulder, it's like the bursa, the biceps tendon, the cuff, the capsule. Like it's really hard to tell, and so I feel like that makes it really tricky to narrow in on like whether it's impingement or whether it's just like eccentric overload or a little subluxation. So I think that you have a variety of tests you can use, but you kind of have to use your best judgment about like we think it might be a few things. It's not going to be just like this one tendon is squished and it's causing like problems.
Right, and it's the squishing is causing the problems because we do know biomechanically that you impinge every time you move. right? So meaning like there's no like loose space. There's not like a gap and then it pinches, right? Like that we can always say, like you have your tissues impinging all the time. But I do think we also have some evidence that shows when you decrease the subacromial space that you have more impingement and you have more stress and you have more compressive force on those structures. So are they correlated? I don't know if we'll ever know that answer, but I do know that we can do things. Even though every time you move, you impinge and you're impinging, there are ways that we can actually decrease the threshold to be able to do that. If you have tightness that results in suprahumeral migration, that is going to wear on the tissue faster. That is going to cause more inflammation. That inflammation can cause a cascade of other effects, metabolic, physical, everything, where now the tissue has decreased ability to handle stress and you start having like a tensile tear, right? So this is like so complicated and we're trying to make it simple by just calling it one junk term. That's why nothing is perfect. There's no one test, no one treatment for this type of thing. So it's hard to say like does shoulder pain impingement not exist. I think that's too simplified to go in that direction and say it doesn't exist, because I think you're doing the exact opposite by telling people it doesn't exist. Then that's like, all right, we'll just like keep doing kipping pull-ups and keep jamming it in there, even if like, you know, if you have no other issue. That jamming and that impingement over time, that's going to cause stress, right? You know,
I think social media likes to take extreme positions, obviously. I think this is where it's coming from, because I've seen it out there and I just blow through it because it just doesn't fit my thoughts. I think
it doesn't. You're confirming your bias.
I'm very biased. I love to live a biased life. I know the term impingement can be very harmful for people, and that they think that's another.
Come on.
I know, but
come on.
This is the
does
argument.
Anybody think shoulder impingement's harmful?
I don't. But people, that's one of their arguments is that you give somebody that
like,
diagnosis.
Impigement's not like that scary.
I know.
Oh wait, all right. What if we call it shoulder impingement syndrome? That's harmful. That could be harmful.
Yeah, it's the extremities, the extreme positions on social media. I think over time, impingement is relevant. I mean, I think it's obvious. Like, yes, we impinge on most of the movements that we do, especially overhead, but there's a point where the tissue just can't handle the capacity to handle that. In a 40-plus-year-old is going to be different than somebody in a 25-year-old who's kipping and lifting and doing overhead press and all that. There's a reason why we see cuff issues in people that are 45 plus years old. So I'm in that world now, you know what I mean? So the lack of blood supply, lack of the ability to handle the stress on it, eventually something's got to give. So I think it does exist. It doesn't probably exist as much as we want to think, but it certainly is not a term that we just need to throw out because it's not relevant. I just think if you describe it correctly to the person, what potentially is going on with them, and how you have a solution for them, I think the term impingement is not going to be so detrimental to their life.